Medicine and Molecular Medicine podcast. We're going to be doing this podcast from the Vienna, from the EANM in 2017. But before I get on to that, which is a good podcast that deals with new forms of image reconstruction for SPECT, I want to talk a little bit about what's happening in Melbourne next month in April. That's the World Federation of Nuclear Medicine Biology. And if you don't know about it, it's really like the Olympics of nuclear medicine. All of the world federations of nuclear medicine get together once every 4 years, and that means some of the best stuff you'll ever see all happens in one place. So we're doing lots of speakers from all over the world, but just from here in Australia, I'll give you a hint of what we might be doing. What we're likely doing is theranostics. Melbourne, for example, is one of the leading sites for that. We've done things like cancer therapy for prostate cancer, cancer therapy for bowel cancer, cancer therapy. We all know about the cancer therapy that's really working with neuroendocrine tumours. So that's the kind of stuff that we're going to be dealing with, and new ways of doing that, new ways of monitoring that therapy with PET and SPECT, new traces and new ways of dealing with that. We're also going to be looking at neurology, in particular new amyloid traces, new tau traces, new ways of using those traces to manage the therapies which are beginning to work in Alzheimer's disease, and to deal with some of those controversies that deal with that. There's going to be a lot of exciting stuff, and I didn't even mention the cardiology. So just Google World Federation of Nuclear Medicine and Biology, and we'll be able to make you a link and come down and see us. It's a great place to visit. Meanwhile, let's get on with the podcast. Right, thank you again for agreeing to talk on the Nuclear Medicine and Molecular Medicine podcast. And we're again here at the EANM 2017 meeting in Vienna. And I just listened to an excellent talk on an area that I think's got a lot of room for growth and a lot of room for development. Perhaps before we get into that, perhaps you could introduce yourself, tell us what your name is and where you're from.
Yes, my name is Emma Wikberg, and I'm from Gothenburg University Hospital, or Sahlgrenska University Hospital, but Gothenburg University, yes.
In Gothenburg, I've been there. It's a lovely place.
Yes. yes. And so you did a presentation, and maybe I'll just concentrate on one aspect of it. You looked at a very interesting method of reconstruction of PET images. What was SPECT
that? SPECT images. Sorry, what is that? Yes.
Yes, it's a reconstruction code that we have written, or my colleague here has written, and it's a reconstruction code that uses Monte Carlo simulations in the forward projection of an iterative Olsen reconstruction.
Right. So, I mean, that's a little different, because normally you do just a direct projection method in the forward projection before you do your iterations back again and update it. But by introducing Monte Carlo, it's going to represent more a real-world situation for SPECT. You'd agree with that?
Yes.
Right. So one would expect that this reconstruction would improve the resolution of the images without producing the artifacts generated by a point spread function. Would that be a fair comment?
Yes.
Right. So, I looked at the images, and that's what they look like. Right?
Great.
Right, and they look good. They look very good. And of course, this is a clever way of doing things. However, when you came to test them, it didn't go quite as what you'd expect, I would have thought. Tell me about what happened.
Yes, so we had a trained nuclear medicine specialist look at the images, my colleague here, and he could not detect the metastases that we knew were there, although we had used this new reconstruction technique. But I think that one of the reasons is that the observers today are not used to viewing or reviewing the images because it's a new way of looking at the images, but also the metastases that we looked at are so small that we didn't know they were there when the examination was done. So we did a 3-year follow-up, and we could see that a couple of patients, or 13 patients, had liver metastases. So we don't know if they are there. We actually don't know the truth or which patients that have the metastases, or how big they are or how small they are.
Right.
So
I guess one way you could do this, instead of using observer confidence, you could test this by using a data set with a known truth, or two groups of people with a known truth.
We are working on that right now. We are simulating metastases into the raw data, and then reconstructing the data, so we know where we have put the metastases. Yes.
Right. I wouldn't be so concerned about the early acceptance of these type of images. I know in the early days of SPECT and early days of Recon, when we did things, a lot of doctors didn't like it. They said it looked artificial, it looked plasticky. They're confident. They thought this is magic. They didn't have confidence in those images that it was telling them what they expected. They thought that this might look too good to be true. In fact, it wasn't too good to be true. It really did improve things, but that was the belief. And even now, many years later, when iterative reconstruction is moving into CT, you spoke to radiologists, they'll say, oh yes, these iterative reconstructions of CT, like FLASH for example, so they look plasticky, they don't look right, you know, and that's often the initial thing. So maybe you're better off using some objective measure of a quantification of other types of scans, not necessarily metastatic disease, but comparing regions of the heart or parts of the brain or other sorts of aspects in order to use this. And of course, your technique could also be used in many ways in not just SPECT. It could be used in other things too.
We are thinking about advancing to PET imaging because of at Sahlgrenska University Hospital we don't do the octoscan anymore. We use gallium-68.
Yes, indeed.
Yes, so we have thought about that, and maybe advancing to PET imaging.
Yes, I think that'd be very encouraging, and I think there'd be a lot of space for that. I thought that was a really interesting talk. I really appreciated it. Anything else you'd like to add?
No, I don't think so.
Right. How about if you tell us where we can find out more information about the work you're doing?
Yes, we have a web page.
Yeah. www.phonsa.se.
Yes, fonsa.se.
Okay, excellent. Well, thank you very much for taking your time. I know you've got a plane to catch.
Yes.
And appreciate you coming along to the meeting.
Okay. Thank you very much.
Okay.
Thank you.